We work with the crisis centers every single day, and we work to provide services to make their jobs even better and to raise the profile and the awareness of the services that are available in their communities. So some examples of things that the crisis centers do working together, maybe we can move on to our next slide, Lauren, would be great. The interactions that the coalition has with the crisis centers are absolutely daily. Every single day we're in touch with the member programs in a variety of ways. So while they're on the front lines providing direct services, we may be putting together a training curriculum or working on a statewide protocol. We administer the Sexual Assault Nurse Examiner program to ensure that high quality medical care and forensic evidence collection are available to victims. We work on putting together statewide protocols that are then implemented in communities throughout the state of New Hampshire. A great example of awareness that we're doing right now is in April, we launched a statewide sexual assault awareness campaign during Sexual Assault Awareness Month that will help survivors throughout the state of New Hampshire know that services are available in their communities. So every aspect of our work is commingled with that of the crisis centers. And as it relates to our work with you, this is another great example. We hear from crisis centers how the laws in the state of New Hampshire are serving victims well or may need to be improved. The coalition in turn comes and works with you to strengthen those policies and to advocate for laws that will better help victims heal and receive the justice that they're seeking. So the slide you see is, has a lot of information on it, and we will be sending these slides out to you after the presentation, but we just wanted to give you a sense of how the crisis centers and the coalition work together, because it's also really important when you see us at the State House to know that we are there shoulder to shoulder with our member programs and on behalf of the member programs and all of the survivors they serve each year. So if we can bump to the next slide. So speaking of survivors they serve each year, this is the catchment map for the 13 community-based crisis centers in New Hampshire. And what's important to take away is that every single community in New Hampshire is served by a crisis center. And when we send this to you, there's a second page that has the contact information for each of the individual centers. But I do just want to note on here that the statewide hotlines, both sexual assault and domestic violence, are listed there. And when anyone calls those hotlines, they will be connected to the crisis center in their community. The other thing that's important about the hotlines is to know that a person doesn't have to be in crisis to call. If someone wants help or information or to know how to better support a survivor, calling those hotlines is a great place to start. The other thing that I think is really important to know looking at this map is that these crisis centers, which are not very big organizations, serve 15,000 survivors every single year. Primarily in the past, those have been face-to-face services, and you're going to hear some today about how we're adapting to make sure that those services are available to them.